My name is Lorraine Smith-MacDonald and I'm a PhD student at the University of Calgary in the Faculty of Nursing. I served as a civilian cadet chaplain in 2007, and while I was there I was serving at CFB Gagetown, and at that time the bulk of the troops, the Army troops that are stationed there, were deployed to Afghanistan. And in my work I began to notice that there were significant difficulties both for the families that were left behind and for the youth that we were caring for, and also for the veterans coming home. And this kind of sparked a curiosity in me, and so I began researching throughout my MDiv and my MA, looking at more generally mental health within combat veterans and veterans in general, and then began to sort of look into what it was that might assist or harm them. And what I began to notice was that at times there was a disconnect or discord between what the medical literature said and what veterans themselves said. One of the other curious things that I found when I was looking at the literature was the lack of veterans' voices in specifically the clinical or medical or academic literature that is most commonly used to make policy decisions. And so for me, it was absolutely essential that I include veterans' voices. To be honest, I see the veterans' voices as the heart of my project. It's not about what I have to say, it's not about what my research will come up with, but it's really about being a conduit through which veterans can speak for themselves, and hopefully through the research that I'm able to do, that I can then take those voices with their assistance and then again come up with more therapeutic interventions and care, and maybe even possibly changing some policy around the kind of care that we offer. Hey Mike.
Hi Lorraine, how you doing?
Good to see you, man.
Good to see you too.
How's work going?
Oh, busy as always.
Yeah?
How's the research going?
Pretty good.
Having a process that's more veteran engaged, veteran empowered, hopefully will be more successful. We've got a high level of success, but there's always going to be people that fall through the cracks. So making more programs available so that more people get engaged, so that we don't lose anyone. One suicide is one too many, but unfortunately this happens, and the more we can empower the veteran community to engage and believe that they're putting something into the treatment, because if you engage a veteran and say, if you do this, it may help the people behind you, they're way more likely to step up.
I think it's very important that we begin to move into this model of patient-oriented research in healthcare especially. Healthcare is such a unique experience to be working in, because you are talking about, and often it gets lost in the literature, you are talking about legitimate people with legitimate problems and their lives. And so sometimes, we always joke, that you can everything gets boiled down to a number or a diagnosis in healthcare. So it's patient number 2 with PTSD, or it's patient number 3 with, depression, or whatever it is. And so I think it's absolutely essential, especially today,